For COVID-19 vaccine injuries and long COVID syndrome, there's a paper by Diexer and colleagues showing that 70% of everybody suffering with long COVID is due to the vaccine. They've taken multiple vaccines. The vaccine is a bigger factor than having COVID. So most of this is being whitewashed as long COVID. The Biden administration and HHS has written a research plan. They spent $1 billion on long COVID. In that research plan, they never consider whether the vaccine is the cause of the problem. They assume it's COVID. In fact, it's all whitewashed as COVID. That $1 billion has generated 0 new drugs, 0 protocols or strategies, 0 new in vitro diagnostics. It's the biggest waste of $1 billion scientific dollars I've ever seen in my life. Nothing's been generated out of it. So myself and others have taken matters into our own hands, and we've published the first peer-reviewed journal on detoxification of the spike protein, removing the spike protein from the human body based on a theoretical basis and some limited human studies. It's called Base Spike Detoxification. It was published in the Journal of the American Physician and Surgeon. It's also on the European Commission preprint server. And it proposes, it's a proposal, that people who have symptoms after multiple rounds of COVID or the vaccine detoxify, that is, help the body break down the spike protein for removal using 3 natural substances. First one is nattokinase, 2,000 units twice a day as a low dose, can be increased. Bromelain, 500 milligrams a day. And then curcumin, which is a derivative of turmeric, 500 milligrams twice a day. And this is based on the best available literature. I've tried every prescription drug that exists. There is no cure for this in the prescription pharmacopoeia. But I do believe that this triple combination, after direct observation in my practice for over a year, people are getting better case by case. I just held a meeting with hundreds of doctors in the United Kingdom, and I wanted their practice experience on this, and they are finding people get better. Now, it takes 3 to 12 months for people to slowly get better. And we do add additional drugs depending on what the problem is, particularly blood thinners when there's blood clots. But as a proposal, I want the committee in the state of Arizona to hear that doctors are trying to do things to help patients, and without any funding or recognition by the federal government, just like with the treatment of COVID, we will have to pave the way in helping people resolve long COVID and vaccine injury syndrome.